We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nishnawbe, Ishkildwen, and Nishnabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Thank you and good evening, everyone, and welcome to the Board of Directors of Windsor Regional Hospital's meeting for Thursday, May 1st, 2025. I will call the meeting to order at 5:02. And the first item up on our agenda, and we have a guest, is for the Windsor Essex OHT presentation. And Joyce Zuck is here to join us this evening. Thank you, Joyce, for coming. And we look forward to your presentation this evening. I'm not sure, Karen, if you have any preamble, if you just want to turn it over to Joyce.
Sure, I can do a short one. Thank you, Joyce, for attending. Joyce has recently taken over the position as Executive Director for the OHT. We've got a lot of exciting plans coming up and work that's been accomplished, so I thought it was good timing for her to give us an update. So thanks, Joyce, for joining.
Thank you so much, Karen. Can everyone hear me okay? I'm not on mute? All right, good. Really appreciate the opportunity to appear before the board of Windsor Regional Hospital and share with you a little bit about what the Ontario Health Team is doing. Now, because we are on the YouTube station, I thought it might be helpful if we just perhaps give your viewers a little bit of a background as to what is the Ontario Health Team. As Karen has mentioned, I actually joined in the leadership role at the Windsor Essex Ontario Health Team in January. And probably if I had a dollar over the past 4 months for every time someone has said to me, what's the Ontario Health Team? I might be able to retire sooner than what my initial plan is. So it really has given me the opportunity to share with folks what our We OHT is doing here in Windsor and Essex County, what We OHTs are, and I'm very pleased for the opportunity to share some of that vision with you this evening. So with that said, why don't we go to our first slide? So okay, we'll skip that one. Let's go to the next one. How about the next one? Thank you so much. All right. So what are Ontario Health Teams? Well, Ontario Health Teams were established in 2019 under the Connecting Care Act. Of course, when we have changes in government, one of the first things they like to focus on is how are they going to make improvements to healthcare? And one of the things that the Ford government brought forward was the concept of Ontario Health Teams. And when I try to explain to folks what Ontario Health Teams are, one of the equations that I like to use is I ask folks to remember back to the days when we had district health councils. In Windsor and Essex County, we used to have a district health council whose primary function was to do health system planning. And that is really one of the primary roles of Ontario Health Teams. Ontario Health Teams are geographically based, so we have one team for all of Windsor and Essex County. And fundamentally, what our role is to be engaged with health system planning. Ontario Health Teams were set up to provide a new way of organizing and delivering care, focusing on patients at the center, patients and families and caregivers, and designing a system around them. Can we have the next slide, please? So as I said, we are geographically based. So there are 58 Ontario Health Teams. They were established in different waves. And in Windsor and Essex County, we were part of the third wave. And we can go to that next slide. So I have a little bit of a visual here. And this really speaks to the fact that what the intention of health teams are is to really focus on that patient and caregiver care. It's to build a system around the individual. Now, some of you may ask questions like, well, what does that mean? We're already patient focused. We're very committed to delivering the highest quality of patient care. But let me pose this question to you. If you were very ill in the middle of the night, if you fell down and injured yourself and perhaps broke a leg, you would know where to go. If you were in labor and expecting a great joy of a new baby, a new baby, you would know where in the community to go. But it's not always very obvious where you might go if you are experiencing challenges with your mental health. Maybe you have a loved one who has experienced a challenge with a substance use disorder. Maybe you don't have a primary care provider, such as a physician or a nurse practitioner, that you would go to get your vaccinations or your annual flu shot. Maybe you're using a walk in clinic and there are other tests or supports and services that you're looking for. And how would you find out how to access those services? And what we're really trying to do through health teams is trying to create a more coordinated system where there are warm handoffs of individuals, patients, and their caregivers and families so that the system is speaking to one another. The system is navigable for the individual because the system does the navigation for that person. Can we have the next slide? So let me tell you a little bit about the work that the Windsor Essex Ontario Health Team is doing. Even though we are local system planners, we are guided by priorities that are established by Ontario Health. For the past year, we in Windsor and Essex County have been working on the 5 priorities that we see on the slide in front of you here. The first one is integrated care through population health management and equity approaches. The second one is system navigation. The third is how we're employing data and digital technologies to improve healthcare. The fourth is around a collaborative decision-making process. And the fifth one is about primary care engagement and leadership. And I like to talk about this one by saying nothing about our health system changes without the complete and full engagement with the primary care providers. Now, in your package that I did hand out prior to this meeting, I go through each of these and I talk a little bit about what Ontario Health is giving your Ontario Health team direction on as it relates to each of the priorities. But what I thought might be a little bit of fun for you and some information that's useful is to hear how your Ontario Health team this past year has managed to action each of those 5 priorities. And I'm just going to ask if we can take the slide deck down so that I can see everyone and just say, I'm just going to pause for 1 minute and see if there's any questions based on what I've already put forward. Okay. All right. So let me share with you a little bit about some of the things that as an Ontario Health team, we've been able to achieve for the residents of Windsor and Essex County for each of those priorities over the past year. So priority 1, integrated care through population health. We have an initiative that has been led by our Canadian Mental Health Association Windsor Essex County branch called Locally Driven Population Health. And the mandate of that work is to get out into our community to find those groups of individuals who are less likely to access our healthcare system and as a result have poor health outcomes. How do you find folks? These are probably individuals that are least likely to seek out primary care. They're probably not attached to a physician or a health team practice. And so we are being asked to find innovative and creative ways to try to engage with these communities that are really at high risk of poor health outcomes. These are also individuals that are probably more likely to use our emergency departments as their first point of access for primary care. So one of the strategies that we have come up with is an outreach strategy. And through this strategy, we are going and we're having health fairs in communities where we know there are large groups of individuals who aren't accessing primary care. We're bringing things like immunization clinics, health screening, smoking cessation courses and information. We are doing special engagement with children and youth. We're talking about mental health. And perhaps most importantly, what we're doing is as individuals come forward and they identify for us that they don't have a primary care provider, we're working with our community health center, the Windsor-Essex Community Health Center, and the Community Health Center at CMHA to attach those individuals to primary care so that they can have ongoing health care. We have also, I'm sure that you have heard about the fact that in Windsor over the past couple of years, we have had a high percentage of individuals seeking asylum in Canada. They don't have status, but they have health care needs. And working very closely with our hospital partners and our Windsor-Essex family health team, we have managed to establish dedicated care pathways so that those individuals can access primary care. We have brought a great deal of health education to Windsor and Essex County for our healthcare providers, including a state-of-the-art trans health training, where we have established trans health champions in our community to make sure that there is equitable care for all. And the other one that I want to highlight, because Windsor Regional has played a critical role here, is with our lower limb preservation strategy. And I am very pleased to announce tonight at this meeting that we have just received confirmation that the excellent work that has been done through that strategy is going to receive funding for another year. So good work. Now on priority 2, we're focusing on system navigation. And the focus of our work there has really been trying to create more information and resources to help individuals understand our mental health and addiction system. Some of the fundamental work that has taken place is the collection of resources and information that is housed on one website at the Windsor-Essex County Health Unit, where you can go and search that site. The search function is very highly sophisticated to receive all kinds of information, referrals, and connection to mental health and addiction resources. The other thing that we did in the late fall is we're looking at this whole issue of the alternative level of care that our hospitals are constantly challenged by. Now, I would like to say that our ALC, alternative level of care rates in Windsor and Essex County, are excellent. We're hitting our benchmarks consistently, but of course we can always do better. So one of the things that we're looking at is, we know when someone is ready to be discharged from hospital, and sometimes what the missing piece is there aren't community resources available to pick up the supports that an individual might need post and acute care stay. And so we've done a mapping session to really look at what those gaps are, which has led to the creation of a work plan. And this year, we're going to start to operationalize that work plan. And of course, I'd be remiss if I didn't mention that we're constantly involved in seasonal surge planning. So it's probably too late to get your flu shot now, but it's not too late to start thinking about it for this coming fall. We also, one of our priorities is around data. We know that if we don't have good data, it's difficult to make good decisions. You probably know that our hospitals participate in a provincial database called IDS. And one of the big investments that we've made this year is to get our EMS service on that database. So imagine the important information that we're going to be able to collect and share when we have our hospitals and our EMS feeding data into the same database. The other thing that we spent quite a bit of work on, and Jonathan Foster's here, and he's been leading some of this work, is on the utilization amongst mental health and addiction providers in Windsor and Essex County of a platform called Ocean E-Referral. We're trying to get away from the paper faxes, and if we can send an electronic referral, and if we can receive referrals electronically, it gives us access to information about patients so that patients don't have to tell their story over and over and over. And the theory is that we should be able to get folks treatment and support much faster by using these electronic platforms to share the information. I want to give a big shout out here. Another piece of work that we've been very involved with is Connect My Health. So many of you might know that Connect My Health is a digital tool where patients can actually have access to their own test and diagnostic records. I want to give a shout out because Windsor was #1 in Ontario for registering individuals with Connect My Health. And the reason that we're #1 is because of the unwavering support from Windsor Regional Hospital. Our volunteer boots on the ground Ed is there on site almost every day. And because of that partnership, we're #1. But more importantly, patients have more power because they have access to information. All right, so let's move on to our other priority, which is around collaborative leadership. Probably one of the biggest learning curves that I've had moving into this role is this whole conversation we're having around what does collaborative leadership in healthcare look like? Now, keep in mind, the Windsor Essex Ontario Health Team is a collaborative. It's a group of healthcare providers, including hospitals and community health centers and family health teams and physicians and agencies that are coming together to strengthen and make a more integrated healthcare system. There's no governance structure like a board. There isn't. We're not accountable to Revenue Canada. We're accountable to the residents of Windsor and Essex County. So we need to find ways for us to work together. For us, when we hear that funding is going to be announced, how we're going to work as a team, as a whole, to make sure that those investments are strategic and are going to help us to achieve the highest and best health outcomes. So a couple of things that we have done this year. We have a decision-making agreement that governs the Windsor Essex Ontario Health Team, and we updated it. The agreement was approximately 3 years old. Things change. And one of the things that we're doing is we're adding more individuals to our steering committee that guides the Windsor Essex Ontario Health Team's work as we become more mature in our operation. We've also done some operational pieces like update terms of reference. Because we're not an incorporated body, those terms of reference become really critical guiding documents that help to guide us. And the other piece that I'll share is when we have a meeting, all of our decisions are made through consensus, which really makes us work hard to hold our feet to the fire to make sure that we're always thinking about the system first. A couple of big initiatives that have happened this past year, which you might have heard about in the news. Windsor and Essex County will be receiving an investment to establish a heart hub. It's a homeless and addiction support service. It's an unprecedented investment in homelessness and addiction treatment. And to come together, we actually had 3 organizations agree to be the co-leads. Something like this, getting 3 and getting the number of partners around the table, how to best figure out how to spend those dollars was quite a bit of work. But we know because of that hard work, we're gonna get a better outcome. And then the last piece that I want to put in is that the input from patients and families in all the work that we do is critical. And we have a very strong patient and family advisory council to the health team. We've engaged the members of that council in all of our different trainings. We are helping them to get appointed to provincial and regional committees that look at how we can continue to fully engage patients and their caregivers as we build a more coordinated system. And so the last piece for me is a critical piece, and it's really in the past few months that we've really been moving quickly on this one, and that is the engagement and the leadership from primary care. One of the key pieces for this year that your Ontario Health team needed to achieve was the establishment of a primary care network. And I'm very pleased to announce that we did that in early January. The network has been meeting every month to help guide the decisions that we're making. And the best example that I can give you for some recent work that has taken place just in the past 2 weeks is there was a call for proposals from Ontario Health for team-based care expansion funding in Leamington, and the input from our primary care network wasn't only a requirement of the application, but it was critical feedback and support that informed how we actually built that application. So that just gives you a few of the highlights. We've just received this morning direction from Ontario Health for 25-26, what we're going to need to be focusing on. We will be working on our work plan, looking at how we can attach more Ontarians to primary care is a fundamental and the most critical mission that Ontario Health is asking us to be focused on. I want to end by saying we would not be able to do the work that we do without the backbone support that is provided by Windsor Regional Hospital. And when the Ontario Health team was formed, we needed a health administrative sponsor. And Windsor Regional put up their hand right away, acknowledging the leadership role that this hospital plays throughout our community. And there's lots of work that is being done by your leadership team to make sure that our Ontario Health team is meeting the objectives that are laid out for us. But more importantly, that we are moving the needle on health in Windsor and Essex County. Our goal is to improve the outcomes, the health outcomes of people right across this region. And working together, we will make that happen. And I'll just open up if there are any questions. Hope I didn't go over my time too much. I probably did.
Thank you so much, Joyce, for such a very, very informative presentation and for also giving the broad overview. Very helpful. So again, thank you. Are there any questions or comments from the board for Joyce? Yes, Lori. Oh, Lori's clapping. So she's clapping. Anthony, you have a question?
Yeah, Joyce, what do you think the biggest challenge is going to be over the next 6 months to a year that you're facing, and what can we as a board do to support that?
Thank you for that question. It really is a good one. There's a couple ways to answer that. I think the biggest challenge that our region has, based on what Ontario Health is asking us to look at, is how are we going to get this many patients attached to primary care. The province has set a very ambitious goal that they will attach 2 million Ontarians to primary care by 2029. And that's an ambitious goal for a lot of reasons. First of all, we asked, do we have the resources to make that happen? And by resources, we mean physicians, nurse practitioners, team-based care. So already we're starting that work with the first piece of that being done in Leamington. We expect that there's going to be a second call for expansion proposals later this summer for early fall. And so I think that direction's hard for us. I think the other piece, like just from a local lens, is as we're doing our mapping work, we are recognizing that there are gaps in service. There are some services that in Windsor and Essex County supports that we just don't have. So when the discharge planners at the hospital are looking to discharge someone to community, because they're at that point where they are ready. In some cases, there are just not those community supports available. And so we do have to look at the resources that are currently allocated in the community and perhaps how we can better realign them to meet the needs now. And then the third piece that I will say is what we continue to see in the mental health and addiction side is that the demand for service is continuing to outstrip the supply that we have to offer. And so, of course, there's an economics piece to it. You either look at increasing your supply if you can, and we should. But the other piece is we are going to have to look at how we can do our business in more efficient and, in some cases, different ways. So the employment of digital strategies, looking at data to make sure that we're focusing dollars where the need truly is, I would say is another piece that we need to focus on. Hope that answers that question.
You good, Anthony?
Yeah,
Okay,
yeah,
thank you.
absolutely.
Thank you, Joyce. Dr. Samar?
Oh, hi. Thank you for such a great presentation. I've actually heard your presentation a couple of times, and I always in extreme awe of the great interventions and programs that you've developed with the OHT and the role it has in our community. But I guess I just had two questions. The first one being, of course, manpower is one of the, I think, bigger issues as well. And even though I think you have such great programs that we have implemented, just wondering if you've had any issues with respect to manpower, especially with the outreach programs.
Yes, that question's a good one. And I guess like maybe one of the things I want to do is I know that Dr. Jacobs is on the call. We are benefiting so much from having the medical school here. And so when we look at what the resources that we need in Windsor and Essex County to look at patient attachment and to look at some of the demands and stress that we're seeing on our system, finding ways to continually to look at that incredible asset of that medical school and the School of Nursing, and how do we work with them? How do we work with those schools to make sure grads want to stay and work here in Windsor and Essex County? On the community side, one of the things that we have talked about is how can we collaborate more when we're looking at recruiting staff so that we're not in competition with one another. And we see this all the time. We'll have a community health partner that's got an advertisement up for an allied health professional, and they may hire somebody, but perhaps that person is leaving another health organization. So at the end of the day, the net resources that we're adding just are not there. So that's one of the things that we want to look as. If we can pool our resources and work together, we may be able to attract more individuals to come to work and to practice in Windsor and Essex County. And again, I do like to stress, and Ontario Health likes us to continually stress, the employment of digital resources. And we are very pleased that we're able to work closely with Transform Shared Services and to be on top of the latest and greatest things that Ontario Health is rolling out.
Okay, well, thank you. Thank you for that response. Versus in terms of the students that we have that are training in healthcare and whatnot might be a good avenue to try to sort of, find the bodies to fill these roles. Now, and my next question is probably a little bit of an embarrassing question because I've been trying to figure this out the last couple of months. But so how are you connected with the LIN? Do you replace the LIN, or is this in conjunction with the LIN, or
That's a good Don't
yeah.
be embarrassed. That question's a good one. Everyone says, what happened to the LIN? So part of what happened through the Connecting Care Act is the province of Ontario moved away from that LIN structure. So LIN stands for Local Health Integration Networks. And for many, many years, that was our coordinating body. Our LIN covered the Tri-County area of Windsor, Essex, Chatham, Kent, and Sarnia and Lambton. And they were responsible for health planning. They were also responsible for funding and accountability agreements. And the government, I won't speak to the politics and the decision making there, but basically they've moved away from that structure. They've created this Super Ontario Health that combines several Ministry of Health functions. And then for the local involvement, they've really gone local with Ontario Health teams. and entrusted us with the role of health system planning and integration and fostering collaboration. So the LINs are no more.
Okay, good to know. So that's helpful for me that I use the right terminology now. So thanks for that.
Yeah.
Thank you, Dr. Samar. I do not see any other questions or comments, Joyce, from anybody. So again, thank you so much for joining us this evening and for the overview and presentation. It is very much appreciated. Thank you.
Thank you so much. Have a very good meeting. Bye-bye for now.
Bye-bye. Thank you. Okay, moving on the agenda, if there are any declarations of conflict of interest. Okay, seeing none, that moves us to item number 4, the previous minutes, and looking for approval of the minutes of April 3rd, 2025. Thank you, Paul and Cynthia. Are there any questions, comments, additions? Okay, seeing none, all in favor? Those minutes are approved. Thank you very much. And now we are under tab C, the report of the acting president and CEO. Karen, over to you.
Thank you, Madam Chair, and good evening, everyone. So my report was in the package. I do want to highlight a couple of important items, or special items, I should say. So one of the things I want to highlight is the regional cancer program work in partnership with our medicine program on 4 West to establish an autologous stem cell transplant program for the patients of Windsor, Essex. So auto transplant or autologous transplant is a specialized form of cancer treatment where a patient's own stem cells are collected and then reinfused with other specialized medications to treat a range of blood-based cancers. Currently, our patients in Windsor, Essex need to travel to London or further to receive both that collection and transplant reinfusion. So this new program, we're going to allow patients to receive this care here in their home community at Windsor Regional Hospital. And we've got a really dedicated, skilled, and knowledgeable interprofessional team that's been working steadily to train and prepare for this new service, which we're hoping to launch later this month and into June of this year. So a really great program that's really going to benefit and help our patients get service closer to home. Next, I want to highlight the generous donation from Dr. Tony and Mary Pattinson of $1.5 million towards equipment and technology for the new Windsor Essex Acute Care Hospital. So many of you will know Dr. Pattinson has been an OBGYN and former department chief at Windsor Regional Hospital. He retired last year after 3 decades of caring for patients in Windsor, Essex. His wife, Mary, is a retired emergency department nurse who worked alongside her husband in their fertility practice. So what they're hoping is that this gift honors the patients and families that they have cared for during their careers and inspires others to support the future of local healthcare. And building our new hospital, of course, is a massive undertaking. We'll need a lot of community support, said Dr. Pattinson. So in recognition of this gift, an operative birthing suite in the new hospital will be named the Dr. Tony and Mary Pattinson Operative Birthing Suite, a dedicated space for obstetric surgeries such as C-sections, emergency C-sections, and other high-risk births. And these will be strategically located next to our neonatal intensive care unit, ensuring all babies receive exceptional care from delivery onwards. So just a special thank you to Dr. Pattinson and his wife, Mary. Also on April 24th, we were notified that Windsor Regional Hospital has officially been awarded the 2024 Gord Smith Healthy Workplace Platinum Award. Gord Smith was actually a benefactor for workplace wellness promotion in Windsor, Essex County, and he worked and volunteered tirelessly to advocate and support inclusion of comprehensive workplace wellness programs for the employees of Windsor, Essex. So the purpose of this awards program is to recognize local employers that provide comprehensive workplace wellness programs for the benefit of their employees. That's a program that's available to all workplaces in Windsor, Essex, regardless of size, etc. What the award recipients must demonstrate is a strong commitment towards improving health by promoting and supporting a comprehensive approach to wellness programming for employees, and ideally includes family members and retirees. And we've definitely shared over the previous years all of the programs that we have available for not only our employees, but our professional staff in the hospital. And we typically will have sold out calendars every month for the programs and services that are offered. So kudos to the team. Of course, today is May 1st, which is Doctors' Day, and that day is dedicated to recognizing and honoring the contributions of our physicians, not only at Windsor Regional Hospital, but across the country. And that date was actually chosen to coincide with Dr. Emily Stowe's birthday, the first female doctor to practice medicine in Canada. And we're looking forward to Nurses Week, which is coming up May 11th to the 17th. So you'll see lots of activity happening over the course of the next week or so as we go through our award nominations. We've got a record. We received over 200 nominations for nursing awards this year. So that's, I think, a record for us. I also attended today the volunteer recognition event, and Anthony was there as well supporting. And we had over 150 of our more than 400 volunteers gathered today to celebrate. So we were really excited to see that. It's really a record number since prior to COVID. We're very lucky to have a dedicated team of volunteers at Windsor Regional Hospital to support our vision of outstanding care, no exceptions, and working in many different departments, supporting our patients, families, and staff, as well as supporting our PFACs, and of course, our lovely gift shops at each site. So thank you to all of the work that they do. Those are the highlights that I wanted to share from my report. I'm happy to take any questions.
Thank you so much, Karen. Lots to be thankful for and lots to celebrate. So thank you for that. Any questions or comments for Karen? Okay, seeing none, that was for information purposes. Again, thank you, Karen. That moves us to item number 6, the Schulich report. And thank you so much, Dr. Jacobs. Over to you.
Thank you so much, Madam Chair. I have a very brief report, just really highlighting the end of our academic year. Lots of good news and lots of successes, and I think lots of wins for Windsor Essex. Some of you did attend our Awards of Excellence last week. It was a wonderful success, honoring a lot of great hard work and ongoing leadership in the Windsor campus. And so I want to thank the hospital for being present, and obviously for some of the award winners from our physician faculty as well. Our students have done very well. Our fourth-year students are graduating next month. All of them were successful in the match. So we do have a 100% match rate for Windsor after the second round, and a very competitive distribution of where they're going, including our goal is always about 50% family medicine. And so we're a little bit below that at 42% are chose family medicine. But we have students doing surgical subspecialties. We have a fair number of internal medicine bound trainees, which makes me happy. But overall, it's been a good win and a good mix from really competitive opportunities. Our local residency programs are also fully matched as well. So that does mean we have 10 family medicine residents starting in July, 4 psychiatry residents starting in July, and an increase in our internal medicine residency training program now for fully matched positions starting in July as well. And the last thing I wanted to update you all on is our overall enrollment per year. So for many years, the Windsor campus was at a steady state of about 36 students per year. Over the last several years, we've been slowly expanding. We are now at 46 students per year. I don't expect an increase in the next couple of years, but we are certainly building our capacity that way with really a lot of support and hard work in our community. So thank you all. That's my report if you have any questions.
Thank you so much, Dr. Jacobs. Any questions or comments from anyone? Okay, seeing none. Oh, yes, Cynthia, please go ahead.
I just wanted to say congratulations, and that's a really good news story. They're all doing very well, and to see the placements and that everybody has been matched up is fantastic. So applause to you.
Thank you very much.
Thank you, Cynthia. Okay, that was for information purposes. That moves us to item number 7, the financial presentation. And Chris Lanou will be doing that this evening. So Chris, over to you.
Okay, thank you, Madam Chair. I will be very brief. We do not have any results because of the fiscal year end. They're still trying to put all that. Finance is working very, very diligently to get us through the year-end process right now. So we don't have anything to report at this time.
Okay, thank you, Chris. Dawn, do we still need to approve that report, even though there's nothing to approve?
No, we don't, Patty.
Okay, I just wanted to
I guess
confirm.
we can accept the minutes though, but yeah.
Okay, thank you. So we'll accept the minutes of April 21st, 2025 and Chris's report. Chris is moving that. Can I have someone second that,
Yes.
please? Thank you, Paul. All in favor? That motion carries. Thank you. Item number 9 is the correspondence and printed material, which is the media report, which can be found under tab E in your report. That's for information purposes. And item number 10, board member questions, comments, or notice of motions. I do not believe we have any. Actually, we do. Anthony, please go ahead.
Yes, I just wanted to say one thing from the volunteers event today. I want to send out a special congratulations to Hazel. I do not have her last name, but she has been volunteering at the hospital for 55 years. So Hazel, you're probably not watching this, but hopefully somebody you know is. I just wanted to call it out. That's pretty spectacular. I think the closest person that I saw today was 40 years. So I mean, she's got 15 years on her closest competitor. So congratulations to Hazel on 55 years. Pretty impressive.
Well, thank you, Anthony, for sharing that. And thank you, Hazel. Hopefully you're watching, and we very much are thankful and appreciate all of your efforts. So thank you. Anything else under item number 10 from anybody? Okay, seeing none. The date of the next meeting is Thursday, June 5th, 2025, and that will be in person at the Met campus in the auditorium room. And with that, I will ask for a motion to adjourn, please. Thank you, Lori and Laura. All in favor? We are adjourned at 5:42. Thank you, everyone. We'll see you on the next link.